digitally enabled care is moving us away from our current system, which is unpredictable, reactionary, episodic, and moving us to a healthcare model that's predictive, proactive, and continuous. And importantly, a healthcare system that is preventive. Just as the check engine light on our cars alert us when it's time to see a mechanic, alerts from wearables and connected sensor products are going to enable individuals in real time to have guidance for self-management of their health. And as this data is being collected and transmitted to portals, our healthcare teams, pharmacists, physicians, other healthcare team members, will be able to look at these insights and reach out to an individual before their symptoms progress, not waiting for many months to go by or somebody ends up in the emergency room. And I'll say that it's this predictive, proactive element, this element that enables an individual to be empowered and engaged. This is what excites me as a pharmacist and has really fueled my passion for digitally enabled care and what's possible to really move us from this healthcare system, again, that today is evaluated solely on the treatment of illness, to one that also has a focus on prevention. In the last few years, we've seen an explosion of digital health products and solutions enter the market. And many of you might be thinking, what's digital health? Well, it's that intersection of health and tech. And if you look around the room, we've got a number of digital health companies around us and on our broader exhibit floor. So what are we talking about? Many of you are wearing fitness trackers. There's about 350,000 apps in the App Store, health apps. We have telehealth. We all are very familiar with telehealth now, that's enabling care anytime, anywhere. There's wearables, connected sensor products. Again, putting individuals really in the driver's seat. They say within a decade, healthcare is really going to be consumer driven. So not only do we have connected sensor products and sensor-enabled medications, where it takes the mystery out of how medications are taken, we also have this exciting new area of digital therapeutics. How many of you have heard of digital therapeutics? Yes. You know, we're calling it digital therapeutics right now, but eventually it'll just be a therapeutic, and digital will be the route of administration. You know, as pharmacists, I think it's too narrow to think of ourselves as the medication specialists, because really, treatment is moving beyond drugs and biologics to software-based therapy. That's what digital therapeutics are. Software-based therapy for the treatment, management, and prevention of illness. They can be used alone or in combination with other medication. So let's geek out on digital therapeutics for a minute, because this also includes immersive therapeutics. Did you know that there's a video game, Endeavor RX, for attention deficit disorder? FDA cleared, evidence-based. For amblyopia, lazy eye, there's a treatment where, guess what the instructions are? A child is to watch their favorite TV show wearing a VR headset an hour a day. Rather than the eye patch that usually has about 30% adherence rate, with luminopia, you're having north of 80% adherence, incredible outcomes, and guess what? Some even overdose. There's a lot more going on in this space, even for pain. You know, we've had so much going on with the opioid crisis. Well, now they're using immersive therapeutics to treat pain. Applied VR has a VR treatment for lower back pain. Okay, so we've got this incredible explosion of digital health products and solutions on the market, and but I'll say, you know what? We're just at the beginning. just at the beginning of realizing the full potential of these technologies to transform how care is delivered, accessed, and experienced. We have regulatory frameworks, like I said, many of these are going through the FDA clearance process. We have early commercialization models. And in the last few years, we've all had this impromptu pilot or scaled demonstration of the value of telehealth services and remote monitoring to maintain essential services. And perhaps you'd all agree that in these last few years, what we've realized, it's not going to be this, in-person or virtual. We've gained an appreciation for the value of a continuum of in-person and virtual, really meeting individuals within the context of their lives, their needs. We're building a health system that is designed around the person, not the clinic. You're going to be hearing more and more about hospital to home or homespital. So, you're seeing my enthusiasm. There's tremendous technology out there. We've got sensor-enabled therapies like Teva's DigiHalers. We've got connected sensor products like Health Beacon's Smart Sharps container. And all of these other products, we've got Pearls really transforming how we gain medical information in a really useful, efficient way. But there remains this chasm. The availability of these technologies is really outpacing integration in clinical practice. And I can take some at the end. I'd love it. And so these technologies are outpacing adoption in clinical practice, and there's all kinds of levers that need to be pulled. One is just awareness, right? So this is really what's fueled a lot of the work that I've done, and with many of you in this room over the years with our digitalhealth.rx summit that APHA holds each year, with having even this digital health pavilion and these tech talks. We want to increase the number of pharmacists, physicians, nurses, other healthcare providers that are aware these technologies exist, and importantly, to trust them, right? Because it is a little bit of the wild, wild west. When I say 350,000 health apps in the App Store, they're not all evidence-based. And so how do we determine what has evidence and clinically valid, right? But there are many that are and have gone through that process, and important is we as pharmacists are aware of this, because I'll tell you what, our health consumers are really stepping up. Quantified self, right, to quantified health. I'm sure many of you have already had people come into the pharmacy and say, oh, my sleep tracker is saying I'm not getting good sleep. What should I do? Is it Ambien? Is it, melatonin? Wouldn't it be great if you could also say, well, the guidelines say start with cognitive behavioral therapy, and here's a digital therapeutic, Sleepio, that's evidence-based, can help you with your sleep. Right? So we want to be knowledgeable about these products, because certainly our patients, individuals in our communities, are going to be aware, and there's going to be a tremendous role for pharmacists to take a leading role here. And others outside of pharmacy see that this could be a tremendous opportunity for us. So we were saying that there's this chasm. One is education. So I guess this is where I get to transition to tell you a little bit about what I'm doing since I left APHA. I was with APHA for 7 years, up until December 2nd. And this passion I have for that intersection of health and tech was so great that I said, you know what? I want to be part of a team that's really addressing this front and center. So we created the digital.health platforming community. We've got a booth right over there. You're welcome to come say hello in a bit. But digital.health, it's really addressing this need. What it is, it's a platform of digital products and solutions where you can explore and compare the different products, and you can even create your own digital formulary of your favorites. You can even share them out in social media. You can go into our e-community and meet other individuals who are either digital health enthusiasts or digital health experts and learn from there. Again, our tagline is learn, share, care. At some point, we'll probably have monthly symposia and all kinds of things. We've got all kinds of neat ideas of how we can expand over time. But to begin with, it's a place where you can begin today learning about these products and how to integrate them into practice. If you are part of a pharmacy school faculty, we've been working with AACP, the American Association of Colleges of Pharmacy, with the American Pharmacists Association, and as you may know, now we used to be CAPE guidelines, so now it's COPA. We've integrated, and it's been approved, that digital health is integrated into that. And we're hoping ACP will also include digital health into accreditation guidelines for the schools. Not in a prescriptive way, but just start to integrate it. Why? Because we really want to start integrating digital health into the curriculum, co-curricular activities, experiential training, postgraduate training, so that our pharmacists are ready, this next generation, to be digitally savvy and be able to utilize these technologies in optimizing care like never before. As I look out at all of you, you've probably practiced in a number of different settings, and I remember when I was at UCSF and Stanford doing my double residency training, I was close to the data. And I was in person with the other healthcare providers. So these relationships and being close to the data enabled us to get involved, really working to top, as they say, our education and training, right? Because we had the data to be able to look and help with medication optimization. In the community, what we've always had is we've had that accessibility in the community, that relationship with the patients. Look at the power of now when a person walks in and they own their data. They're emitting their digital exhaust. They're sharing all of their information. Whew. Now you've got that community pharmacist who's got the relationship, the accessibility, and the data. We could contribute to the health and wellness of society like never before. Hopefully you share my enthusiasm for what's possible. So I will leave you with this, and then I'll take some questions if anyone's interested. Here in closing is what I believe. I believe there's great power in building on this innovation to drive meaningful change. I believe we can transform our current model, which many call a sick care model, and transform to a health care model to simply health. I was at a conference last week and they said there'll be a day where really it's optional to be sick. In real time, we're going to be able to help mitigate and help people to stay healthy to begin with. So here's what I believe. We can contribute to a more equitable, healthier society together. Thank you.